water, and we've all got alternative water tonight. I mean, if you have all these doctors in, they all want the bottled water, honestly. But for years, people just drank water when they were thirsty. Now we're told everyone's dehydrated, drink all the time. Now that the warm weather is here, you've always got to be drinking water. Some people are pretty obsessive about it, aren't they? They walk around holding this stuff. Do we really have to be that concerned?
Well, supposedly the body should give you enough or pushing to say that you're thirsty, drink more water. But of course, some people didn't listen to the body and ignore the body. But otherwise, you don't. I personally do not force myself to drink water. I respond to thirst.
Oh, that's a good answer, because all these people have been saying to me, doesn't matter if you... this is what they say, when you feel thirsty, you're already dehydrated, which is logically hard to deal with. So, drink before you're thirsty, because you might or might not be, I don't know. And of course, trying to lose weight, you're told to drink 8 glasses of water a day. If I do that, I am up all night. So 8 glasses of water, is that too much? Is that plausible?
The idea is to basically keep your stomach occupied so you feel something is full.
Oh, I see. That's good. Okay, so don't drink any water. All right, that's one good thing. What about sun? Again, people want a bit of a tan and so on, but someone said to me, you know what? Don't get tanned at all. If you can avoid any sort of tanning, it really, in the long run, it will all be harmful.
Generally, it's true, very much true, and the skin ages a lot more with the sun. But now this year, a lot of new reports come out. Having sun actually increases your vitamin D, which is actually preventing cancer of the breast, preventing cancer of the uterus, and a few things. So the tide is turning around that after all, the sun has some beneficial effect, because for the last few years we say, don't ever touch it. So, of course, I still get all my children to put on sunscreen, and I put on sunscreen as much as you can here, but the rest of the body having a certain amount of sun now turned out to be beneficial.
What about allergies? Weather changes, of course, and I've never suffered from allergies, but it seems that so many people have them, and it's really quite unpleasant.
The trees coming out, the pollen starts flying, and then grass coming out, this is the season. And then a lot of people start to sniff and sneezes. It hasn't come out yet. Mother's Day is the time when they start to come out, and then and whenever CNE open will be directly season. So the summer is the time.
The stuff you can buy over the counter, will that do the job for most allergies?
No. They are very effective prescription spray, eye drops. I like those because they're external after all, rather than internal. But over the counter, yes, many of the antihistamine, especially now these days, and many of the non-drowsy antihistamine, they work. But I prefer normally use externals first, drops and nose, but not the over-counter nose spray, because they are addictive. They rebound. Yeah, people spray and it decongest, but within a few hours they rebound worse than what you start with. So generally, I tell people don't buy those nose spray over the counter. But prescription nose spray are quite good, and eye drops.
All right. Any question you have about health, we're going to hear from the more alternative, holistic, naturopathic side in a moment. But any question, summer, winter, or whatever, any health problems you have, call in and we'll try our very best. The lines are there to answer every... Well, I won't answer the questions, because what do I know? But these people will. See you in a couple of moments. Ruth on line 5. Hi, Ruth. Oh, she's still there. Hi, Ruth.
Yes, I am here. Hi,
Gosh, I thought we'd lost you there. You're so unhealthy, we'd lost you in the break.
Thank you for taking my call.
Pleasure.
And you look pretty healthy, too, for all those things you take.
Oh, yeah, I could eat an elephant.
Yeah? Well, I had struck to me out about 30 years ago, and I drink lots of water, 6 to about 8 glasses a day.
Yeah.
And it certainly does not make me thin. And I would like to ask the ladies a couple questions.
Yep.
I have a blocked carotid vein in the neck.
Okay. Before you go, I need a bit more volume, either from our audio person or from you, because I'm not hearing you too well.
Oh. I have a blocked carotid vein in my neck, and the one that goes to the brain,
right,
or to the heart. And I would like to know if vitamin E and vitamin C would be good to take to unplug that. The doctor specialist has suggested an operation. I don't fancy that.
Okay, that's a very good question. I think we'll put to everyone about that. So we'll start with you.
Well, the trouble is, once you have a blocked carotid artery, vitamin C and vitamin E are not going to unblock it. That's just the truth. And it's quite a serious condition. Yeah. I mean, this is a condition that can predispose this caller to a stroke or some other serious consequence. Vitamin E and vitamin C's action seems to be more preventive in that case. Vitamin C seems to strengthen the stuff of the blood vessels, make it more elastic, and vitamin E seems to help the blood be a little more fluid. It helps the platelets not stick together and make little clots. So vitamin E might be a good idea for this person, but not as an alternative to surgery. Once there's a blocked carotid artery, there are very few alternatives, unfortunately. But Doctor, you might want to speak to that.
I speak to that because surgery is not the answer, because if you see a 90% blocked artery, they are not the one that's at risk, because if you both are 99% blocked, you wonder why you're living. But actually, it's the flexibility of the artery that determines the blood flow, and most people have no symptoms. It's also the lining, how well is this Teflon coated, and having vitamin E and vitamin C stabilize the lining so that it doesn't come off as a clot. And I do chelation therapy. It's a wonderful treatment for circulation blockage, because it gradually unplugs the artery, and also it will give back the flexibility. Even though you're 90% blocked, if you can expand to 200%, who cares about the 90? Because you still have 110%.
This is controversial. We have to say this. And I just say the word again for people who aren't familiar with it.
Something called chelation therapy, CHELATION, is a method that is not yet accepted by conventional medicine, but it is a dripping in of multiple ingredients, natural ingredients, and one of them is called EDTA, which is a binding medicine that binds metals. So the idea is to bind away some of the heavy calcification that was lining the artery, but you also drip in a lot of rust-proofing antioxidants, and they keep the lining healthy. And people that have angina, blocked artery in the heart, and blocked artery in the leg, and they couldn't walk a certain distance without pain, then after 20, 30 treatments, they start to see, hey, I can walk the long distance, I can climb uphill without problem. So based on result, it works. Okay.
I want to emphasize here, by the way, that if you have any problems like that, you have to see a cardiologist. This is very important stuff. This isn't a head cold or an allergy. This is life and death. I have met people who said it's wonderful, it really works. I've also met people I respect, doctors who say it doesn't work at all. I'm going to come to you.
It doesn't work at all. Chelation is no place for any disease that I'm aware of, and there's done a lot of studies on that. I'm sorry to say that to my colleague here, but there's just no evidence to support that. Vitamin E, we've just completed a study in Hamilton called the HOPE study. They were very disappointed because vitamin E really didn't do very much for heart disease.
You've heard different opinions. They're both valuable and valid. You obviously have to ask questions and talk to people and make your own decision, but make sure something is done, because that is very serious, as you know.
I must jump in about vitamin E. A lot of people take vitamin E. Yeah. That study was fraudulently done to discredit vitamin, and there was tons of study in the world have been done, and this one was sponsored by a drug company using a subnormal dose vitamin E, and by doing that, you say, hey, Michael has been taking water, and then overall Michael has sickness now, therefore water is not useful. I think it was so...
Well, vitamin E can't do you any harm.
Yeah. Probably not.
So, take the stuff, and if it works, great, and if it doesn't, you've wasted a small amount of money, and so, I think, with things that are safe.
Hello?
Hello there.
Hi, good night. Hello?
Yeah, go ahead.
Yeah, I have high blood pressure, and I get a lot of pain and discomfort in my chest.
Yeah.
I went to 2 cardiologists, heart specialists, and I went to the emergency maybe 4 times in the last month, and everything seems to be normal, very good. All my tests from the cardiologist, the heart specialist, the emergency, the 4 visits, everything show perfect. So I'm kind of scared about that, because I think I have something, but yet nobody seems to find anything.
Did you say your blood pressure was high?
Yeah, I got hypertension.
Okay, but when what did you have when you went to see the cardiologist? Did you have an angiogram?
He give me he scanned my system. I don't know. He put I don't know what you call it, but
Did you have that one where you they put an IV in? Did they put an IV in you?
No.
Okay. There is. I'm pretending to be a doctor here, Doctor. I mean, the angiogram, of course, is where they go in through the groin, and I haven't had this done. It doesn't sound that much fun, but there is one in the middle, which is far less invasive, where you have an IV and you go on a treadmill, and they have you sort of working out, and then you go under a camera for a couple of hours.
First of all, you need a good history. And the history is if this gentleman is getting chest discomfort with exertion after a meal, first thing in the morning, you have to consider that's heart, regardless of what's going on.
Lyndon, is it after exertion, or does it just come on unrelated?
It just come on unrelated. Sometimes I get heart palpitations slightly with it, too.
All right.
So it may not be cardiac. The next step is to get a stress test done. You put him on a treadmill, hook him up to the cardiograph machine and see what's going on there.
Yeah. The stress can feel, bad stress can feel like a heart attack across the chest and so on.
There's many things other than the heart they have to think of, as the rib cage at the back often radiate pain towards the front. Your eating tube, your stomach, all these things give pain, and if you can touch your finger onto it and touch a sore spot, it tends to be rib cage pain and musculoskeletal pain. These are the possibility. But yes, I would do a stress test first. If that's negative, try to think hard and examine hard other possibilities, especially if you can be sitting down and feeling pain. I do examine the rib cage first.
Yeah.
I have a couple of questions for the doctor.
I don't know you, do I?
No, but you've heard my voice a long, long time ago.
Oh, okay, because I know an Irish one called Colette. I just wondered if it was... But carry on.
No. I have been to the doctor recently due to tiredness and that, and I had a blood test. And there was two parts of the blood test that were of concern. One, just to give numbers, it should be 31, and one was 109, and the other one was 31, and it was 56. Also, what I'm experiencing is my legs. I'm having terrible, 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 extreme pain in my legs. And if I touch the legs even to try and relieve the muscles, I nearly jump because with the pain. And also the doctor found something to do with the sugar level. Now, I was just wondering, would the liver, with this kind of numbers, have anything to do with the legs, or would that with my legs that maybe I'm 30 pounds overweight, would that actually affect the legs and the muscles and this terrible, terrible aching, shortly after I'm up for an hour or two?
Are you on cholesterol pill?
Pardon?
Are you on cholesterol pill?
No.
Okay. The sugar, of course, diabetic can give you nerve damage and nerve changes. We call neuropathy of the leg. And diabetic are known to have very painful leg and a burning leg. That's one possibility. And when you say all these numbers are normal, I wonder whether some of those muscle enzyme tests, which come often with people taking cholesterol pills, are a possibility. But of course, we are not psychic. We cannot guess what your numbers are.